During the day, the spinal column undergoes continuous compression. I'm Daniele Mazza. I'm an orthopedic surgeon and I'm the doctor for the under-21 national football team. Back pain is a very common condition and one of the main reasons for visits for many patients because the spine supports us throughout the day, and so the pain that occurs is quite debilitating. During the day, while standing, our intervertebral discs tend to dehydrate, so they lose that natural hydration, which causes them to thin out, and the low transmission leads to increased stress on the spinal column. We even end up losing some height, actually. So a person who measures themselves at the end of the day will be a little bit shorter, and this is caused precisely by the compression and dehydration of the intervertebral disc. Sleep, therefore, is not just a time for rest, but a real moment for recovery. Patients sleep between 6 and 8 hours, so we must certainly intervene during this time frame by improving the devices used during the night to reduce stress on the spinal column. MagniStretch technology provides active recovery and doesn't just have a support function. It accompanies the spine during rest, allows for the rehydration of intervertebral discs, and so we use this rest phase for true recovery, unlike other products that only provide nighttime support for the patient. Here, we're not just talking about support, we're talking about a system designed for spinal recovery during sleep. The clinical studies conducted aim to evaluate MagniStretch technology and involved 175 patients. They were evaluated at baseline, meaning at time 0, at 6 months, and at 12 months. The clinical study considered 3 fundamental clinical parameters: the VAS, which is the pain index reported by the patient, the Pittsburgh Sleep Quality Index, and finally, the Spinal Disability Index to evaluate spinal recovery during sleep. Clinical studies have shown a statistically significant improvement as early as 6 months. In the overall assessment of the benefit of using MagniStretch technology, we saw an average improvement of about 40% in pain perception using the VAS scale, about 30 to 35% improvement in the Pittsburgh Spinal Disability Index, and 40% in the Sleep Quality Index. The value of this scientific research is that it has highlighted a relationship between sleep quality and spinal health. This technology is also an important tool for preventing back pain, as many of us spend a lot of time sitting while others spend a lot of time standing, so it's also a preventive tool to avoid potential attacks and pain in the spinal column. Spinal health is a key element in quality of life and in maintaining it over time.